Assalamualaikum. My name is Dr. Amber. Bismillahirrahmanirrahim. Education is the most powerful weapon which you can use to change the world. Today, my topic of presentation is yellow fever. Introduction. Yellow fever is an epidemic-prone mosquito-borne vaccine-preventable disease that is transmitted to humans by the bite of an infected mosquito. 47 countries in Africa and Central and South America are either endemic or either prone to epidemics. The modeling study based on Africa data sources estimated that the burden of yellow fever by 2017 was 84,000 to 170,000 severe cases to 29,000 to 60,000 deaths. And in the past, yellow fever was mostly transported to North America and Europe, causing large outbreaks that disrupted economics and developments of those countries. The recent outbreaks were, the latest was reported on 29th December 2020, and it was in Senegal. And recurrent outbreaks have been reported. Multiple outbreaks have been reported in the recent years. Starting from 2000, my slide is showing only outbreaks from 2017 to 2020, and the latest was reported on 29th December 2020 in Senegal. Other countries that are most affected are Guinea, Nigeria, Togo, Ethiopia, etc. In epidemiology of yellow fever, the agent is the flavivirus that is a single-stranded RNA virus, and the vector for this disease is mosquitoes. And mostly this agent is transmitted to the humans by an infected mosquito bite. All ages are susceptible to this infection, equally susceptible, both genders, and if a person gets an infection or gets a vaccination, then there is a lifelong immunity for that person. Mostly it is common in moist and humid conditions in tropical areas of Africa and Central and South America. And the densely populated urban areas can lead to large epidemics of yellow fever. And in Africa, an intermediate pattern of transmission is common in humid regions, mostly where mosquitoes infect both monkeys and humans and cause localized outbreaks. Both monkeys and humans are the reservoir for this infection. Transmission is through three types of transmission cycles. The first is the sylvatic, that is the jungle yellow fever, in which monkeys is the main reservoir. And when the monkeys is bitten by an infected mosquitoes, then these mosquitoes can transmit the infections to the humans. The second one is the intermediate yellow fever, with semi-domestic mosquitoes infect both monkeys and people. And this one is most common type of outbreak in Africa. And the third is the urban yellow fever, of which large epidemics occurs when infected people introduce the virus into heavily populated areas with high mosquito densities. And in these conditions, infected mosquitoes transmit the virus from person to person. As I mentioned earlier, the vector for the disease is a mosquito, either Aedes or Hemagonus mosquitoes. And the day-biting mosquitoes breed around houses, in forest and jungle in case of wild jungle fever, and or in both habitats, that is semi-domestic. Yellow fever is a high-impact, high-threat disease with the risk of international spread, which represents a potential threat to global health security. This is the brief cycle for showing the pathogenesis of the disease, in which the mosquito bites, causes viremia, and takes 3 to 6 days. The hepatocytes in the liver, there is apoptosis, and the further cycle shows various changes in the coagulating factors, leading to the hemorrhagic fever or shock and death within 7 to 14 days. The clinical picture of the disease shows that most of the persons don't experience any symptoms, but when these symptoms occur, then the most common symptoms are fever, muscle pain with prominent backache, headache, loss of appetite, nausea and vomiting, and in most cases, symptoms disappear after 3 to 4 days. But if the case gets complicated, then a small percentage of patients goes into the second phase, that is the toxic phase of the disease, and more toxic phase within 24 hours of recovering from the initial symptoms. It is characterized by high fevers, and several body systems are affected, usually involving liver and kidneys. In this phase, people develop the typical appearance of a yellow fever patient with jaundice, yellowing of the skin and eyes, and dark colored urine and abdominal pain with vomiting. Bleeding can occur from mouth, nose, and eyes, and half of these patients die within 7 to 10 days. For the prevention, the primary prevention involves health promotion and specific protection. Primary prevention involves vector surveillance and control that are the main components for the prevention of this vector-borne disease. And for yellow fever, vector surveillance target Aedes aegypti and other Aedes species will help inform where there is a risk for an urban outbreak. So under the surveillance, a strong case-based surveillance for yellow fever can help detect outbreaks early as well as spread to the new areas. Occasionally, infected travelers have exported cases to the countries that are free of yellow fever. However, the disease can only spread easily if the countries it is imported to has mosquito species able to transmit, that is the Aedes species, specific climate conditions that are moist and humid conditions, and the animal reservoir needed to maintain it, that is mostly the monkey. To prevent international spread, it is essential that the international health regulations are applied and that travelers to the high-risk areas present yellow fever vaccination certificates. For vector control, mosquito control can help us prevent yellow fever. Mosquito control includes eliminating potential mosquito breeding sites, including by applying larvicides to water storage containers and other places where standing water collects, and where mosquitoes can breed, and killing adult mosquitoes and larvae by using insecticides is also an important preventive measure. Community involvement is of extreme importance through activities such as cleaning household drains and covering water containers where mosquitoes can breed. And personal protective measures include clothing minimizing skin exposures, wearing full sleeves and covered clothes, using repellents that are recommended to avoid mosquito bites, and use insecticides treated bed nets is limited by the fact that Aedes mosquito bite during the daytime. Epidemic preparedness and response is also important. WHO recommends that every at-risk country have at least one national laboratory where basic yellow fever blood test can be performed. And a confirmed case of yellow fever is in an unvaccinated population is considered as an outbreak. A confirmed case is any context must be fully investigated, and investigation teams must access and respond to the outbreak with both emergency measures and longer-term immunization plans. Now a little about the vaccination. Since no specific antiviral drug has been reported to reduce this condition, so vaccine is the most important measure for preventing yellow fever. The currently available vaccines are live attenuated vaccines that are qualified by WHO. Yellow fever vaccine available today is safe, affordable, and only a single dose will provide lifelong protection against this disease. And this yellow fever vaccine, when once given, will provide immunity up to 95% people, and a booster dose is not needed. Yellow fever vaccine is carried out for the following reasons: to protect the population living in high-risk areas, to protect travelers, and to prevent international spread. Vaccination strategies used are routine infant immunization, in which 9 to 12 months of age our infants are vaccinated along with measles vaccine, and mass vaccination campaigns coverage up to 80% of the population at risk is also required. And vaccination for travelers going to endemic areas is also necessary. And in addition, preventive mass vaccine campaigns are recommended for high risk, where every infant of greater than 9 months of age is vaccinated. And during yellow fever epidemic, reactive vaccination campaigns are carried out. And Gavi is an important organization that is supporting the stockpiling of this vaccine all around the world. Who should not get yellow fever vaccine? Babies under 6 months of age, immunocompromised patients with weakened immune systems, including cancer patients, transplant and drug abuse patients, people with thymus disorders, and other immunocompromised conditions like leukemias, and the persons having chemotherapy for that, or under steroid treatment. For pregnant females, yellow fever vaccine has been given to many pregnant women without any apparent adverse effects. Since yellow fever vaccine is a live vaccine, it poses a theoretical risk. But if there is a need, if there is an outbreak, then the pregnant women must be vaccinated. Or if there is a choice, like a pregnant woman can avoid or postpone the travel, then it is a preferred choice. But if there is, in case of an outbreak or an epidemic, the pregnant women must be vaccinated. A few adverse events following immunization have also been reported, and this risk is mostly higher in people over 60 years of age and among immunocompromised patients. Certificate of yellow fever is important, and in accordance to international health regulations, countries have the right to require travelers to provide a certificate yellow fever vaccination. These are the countries that require the proof for yellow fever for all arriving travelers, that include Angola, Central Africa, Congo, and Liberia and Uganda. Among the secondary prevention, the diagnosis. Yellow fever is difficult to diagnose, especially during the early stages, and more severe cases can be confused with other arthropod transmitted diseases like malaria, leptospirosis, dengue, etc. PCR testing of blood and urine can detect the virus in early stages of the diseases, and later the antibody testing through ELISA or PRNT testing is required. Currently, no specific antiviral drug is recommended for the treatment of yellow fever. Early supportive treatment is required either in hospitals, or if a person is staying at home, then the symptomatic treatment is required. Associated bacterial infections can be treated with antibiotics, and patient needs to stay under mosquito nets during the day to limit the risk of spread to others. And vaccination is the single most important measure for preventing yellow fever. In the updates, WHO has started an eliminate yellow fever epidemic strategy known as I strategy that was initiated in 2017 with alliance of WHO, UNICEF, Gavi, and it supports 40 countries and have more than 50 partners, and it was initiated after the 2016 outbreaks in Angola and Domestic Republic of Congo with wider international exportations. This I strategy has developed a coalition with Gavi, UNICEF, and WHO, I have already told, and it was initiated in 2017 and is trying to, and the targets include comprehensive long-term strategy from 2017 to 2026 that mostly targets the vulnerable countries while addressing the global risk and building resilience in urban centers and preparedness in areas with potential outbreaks and ensuring reliable vaccine supply. These are the objectives. In Pakistan, the yellow fever vaccine certificate is only required for travelers of 1 year of age and older coming from countries with the risk of yellow fever. and there is a travel notice, and the countries with risk that are labeled are among Africa and America. This is the certificate that is issued to a person traveling to an endemic area in Pakistan. And recently, a potential epidemic of such diseases like chikungunya and the vector-borne diseases like dengue and yellow, these diseases have increased. So the control of Aedes mosquito should be considered seriously, because as it is a vector for also yellow fever and Zika virus, so there is a considerable movement of Pakistanis to consider this vector, and that and measures should be taken to minimize the risk by this Aedes, so that no more cases should be reported for yellow fever and Zika virus, but chikungunya epidemics have been reported because of this vector, and control measures should be taken and preventive strategies should be applied. Now it's time for the MCQs. Yellow fever is caused by flavivirus. The person infected develops jaundice in back pain, headache, and severe conditions from nose and mouth. Which of the following statement is not correct about yellow fever? Mostly occurs in tropical, subtropical African region. Ticks are the major vector of the virus, presented with necrotic lesion on liver and attenuated. Yes, ticks are not the major vector. Vector is mosquito, that is the Aedes species. How long does 1/5 of the regular dose, that is the fractional dose, should provide vaccination? 3 months, 6 months, 1 year likely, or 1 month?
C.
If we give a partial dose, then it gives the protection up to 1 year or likely longer, but not lifelong immunity. How long does a regular dose of yellow fever vaccine protect you? Yes, it's the lifetime. Sorry, ma'am. I will explain. According to international health regulations, national disease government must report which of the following diseases to WHO for maintenance of infected area list. The answer is yellow fever, because its transmission across the borders is higher as compared to other diseases mentioned in the options. Which of the following is or true about the yellow fever vaccine? Over 6 months of age, who have the history of thymus disorder, who have had a confirmed anaphylactic reaction to previous doses, who are considered immunocompromised due to pandemic. Yes, it is because the babies less than 6 months of age already have maternal antibodies. Only the babies over 6 months of age are given vaccinations. Other options are contraindications for the vaccine. An unvaccinated traveler is at risk of contracting yellow fever in which of the following countries? C is the answer, because it belongs to that chain of African and North American region. Other countries are out of that list. In Africa and South American region, jungle fever is a disease of monkeys, goats, and cattle. Yes, in case of jungle fever, monkeys are the main reservoirs of infection. Yellow fever still exists in many tropical areas of the globe. Which one of the following is the best reason yellow fever still exists? Sewage disposal, both humans and monkeys are the reservoir, the virus has mutated, the people in the developing countries cannot afford to take a mandatory, and the vaccine has been withdrawn because it was found to have unacceptable side effects.
B.
Yes, the answer is B, because the chain of transmission is being maintained as both humans and monkeys are the reservoir for this virus. 45-year-old male presents to the emergency room complaining nausea and vomiting. He returned from the business trip to Nigeria 5 days ago, and he developed vomiting, loss of appetite, and he did not receive any vaccination before traveling. So what while examination, he vomits up dark vomitus. What is the possible cause? Yes, because yellow fever. There are two indications. One is that there is a traveling history, and second, there is no history of vaccination. So, flavivirus is the option, as yellow virus belongs to this family of viruses. In case of an epidemic, how much vaccination coverage is required to control an outbreak? 80%, 85%, 90%, or 95%?
80%.
No, the answer is C. 90% coverage is required as recommended by WHO in case of an epidemic. The 85% was the coverage in mass vaccination strategies. That is the target to be achieved. But in case of an epidemic, 90% vaccination coverage is required to control. This is the key. These are the references, and thank you.
Thank you very much, Dr. Amber. Very nice presentation, and how you have covered all those MCQs and different things. I am very happy with it. Please announce the result. Who has given the maximum correct answer?
Ma'am, Dr. Sadia and Dr. Naila first, and Dr. Meha also answered the questions.
Okay, thank you very much. Now, for you, I have a question. Please mute all those who are not speaking. Please mute your mics. Right. As you have said that dengue and yellow fever both have the similar vector that is involved, and that is the Aedes aegypti mosquito. So what is the risk of yellow fever virus transmission in Pakistan, especially when we are having dengue fever too as endemic disease here in this country?
Ma'am, this point I addressed because if according to international health regulations, we do not have surveillance and we do not keep track of the people traveling from the endemic areas coming to our countries and receiving their certificates or having vaccination status is clear, then there is a huge chance that that yellow fever outbreaks can occur in Pakistan, as the Aedes mosquito is present in abundance in our community. So this is an imminent threat, and we should take this under consideration, and special strategies must be developed, preventive strategies for the control of this Aedes mosquito.
My question is little different. What I am asking you is why the yellow fever has not occurred in Pakistan, and even no case has been reported from South Asia, and what is the plausible explanation to it? We have Aedes aegypti mosquito, we all agree. We have dengue fever, the same vector that is spreading dengue fever is also involved in spreading yellow fever. My question is, what is the plausible explanation that yellow fever has not occurred in Pakistan, not in epidemic form, not in endemic form yet?
Ma'am, I have a little information about it, and I think that the chain of transmission, monkeys are playing an important role. These species, monkey species, and the jungle conditions, the humid conditions, and the reservoir, that is the monkey, is playing an important reservoir in the chain of transmission. And I think this missing part, I think, is
Ma'am,
not,
if can I say something?
Actually, what has never occurred in Asia remains, it is declared as an unsolved mystery, and there is still no plausible explanation that why in whole of the Asia there are not a single case of yellow fever has been reported yet. As you have said that there are some reservoirs like monkeys who are involved. We know it that even monkeys, they are present in the whole of the Asia, and not only speaking about Pakistan, even India and Sri Lanka, there are a lot of monkeys that are present there. Also in definitely in jungles, there are many jungles that are present in Asia. So this is not one of the plausible explanation. And when we consider the evidence that is available, we conclude that the most probably the risk of local transmission of yellow fever, it has been very low, and there are more host factors that are involved rather than the factors that are involved with the environment. We also know that the agent, that is the yellow fever, it is present in the South America and in Africa, but it has not ever been reported from Asia. So it is more host factors that are involved. As far as jungles and monkeys are concerned, there are jungles and there are monkeys that are present, and so there are less environmental factors that are present. And there is a future possibility of transmission in Asia, especially when we consider the large influx of traveling, and especially from the endemic areas. And this yellow fever, as we know, it has been a disease that has caused a lot of mortality over many continents. Not only it is not only have been reported from Asia. So there are three epidemiologically different infectious cycles in which yellow fever virus is transmitted from mosquitoes to humans or other pyramids. When we always talk about the jungle cycle, yes, monkeys act as host, and Africans and other these species as the vector. We know Aedes africans and Aedes aegypti. These are the vectors that are involved in it. However, in the intermediate cycle, that is only noted in Africa, monkeys and humans act as a host with the Aedes species as vector. And when we have the urban cycle, we know that Aedes aegypti is involved with humans as host, is humans, and Aedes aegypti is a vector, and it is well adapted to urban centers, and it can transmit disease such as both yellow fever, dengue, and there is also a very rare disease. It has been reported from Pakistan, and I recently wrote an article on this, that is chikungunya. It is one of the disease that closely resemble dengue, and there are many cases of chikungunya that have reported and they have been misdiagnosed as dengue fever. So the spectrum of the clinical disease, as you have correctly said, it is mild flu-like up to the hemorrhagic fever and hepatorenal involvement. So there are many overlaps in clinical features with dengue fever. And once we have the yellow fever, it is very difficult to find whether it is yellow fever virus that is causing all these clinical features or the dengue virus that is causing these features, because there are clinical features overlap that is present. As far as you have talked about the vaccine, I totally agree that yellow fever vaccine is the most important thing that has to be promoted. And we know that this yellow fever outbreak, it has been there from centuries. Even we have a correct reporting of yellow fever epidemic through surveillance system in 1648. So it is a very long time that the surveillance has been there, and the people, they are very much concerned about controlling this yellow fever. And we know that the tropical and subtropical countries, they are at higher risk, and it also spread to the European countries. And the main reason that causes epidemic in France, Spain, Italy, and one of the most developed countries at that time, England, that epidemic caused a lot of mortality. So the resurgence of the disease there, they suffered in 1920s and 1930s, because there were many people who were out migration, and there was non-immune European population. And when the people from the endemic countries, they for certain reasons like trade and other reasons, when they went to the European countries, they caused epidemic. The successful vaccination, as we know that it has started in 1940s, And it has, yes, it has led to reduction, and that is a significant reduction that has occurred so far. However, even after the introduction of vaccination, that is, we call this period as a post yellow fever vaccine era, still there have been epidemics that have been reported. Like Ethiopia in 1960 to 1962, there were more than 100,000, mean 1 lakh people who die, and there were more than many spread to many other countries, including West Africa and Eastern Mediterranean region, and all the deaths that was included all over these countries were almost in hundred thousands. And what about surveillance? If surveillance has occurred after even the vaccination was available, these epidemics could be prevented. And that is the most important point that we are stressing today, that we are non-immune to yellow fever. So the same story can be repeated, because still we don't have any plausible explanation that why yellow fever disease has not been reported from Asia, and especially from the countries like Pakistan, where the surveillance systems are working on a daily on dues pattern, that are early disease warning systems. So still we don't have a single case that has been reported. According to WHO, World Health Organization, yellow fever surveillance is the most important point, and they are showing the complete surveillance database from 42 countries. So we can see that 42 countries are still having the yellow fever cases, and they are at risk of epidemic at any time. So these are one of the few important diseases. If it spread to Pakistan, unfortunately, there would be a greater loss of human lives, especially the precious human lives. So the major outbreaks can be prevented by identifying the at-risk population. And according to WHO, the estimates are that the caseload is about 200,000 cases, and with 30,000 deaths due to underreporting. So it is not the disease that has been reported correctly according to WHO. It is a disease that is still associated with underreporting. So the at-risk population is estimated as 900 million, and it is living across 45 countries. Mostly they are African countries, but few are also South American. So the important part is that this disease, it has to be given due consideration. So I'm very thankful to Dr. Amber that she has presented very well, and almost all the important points have been covered so far. And the question that I have asked, and the scientists are still looking for the answer. There is not any plausible explanation that is associated with it.
Okay, ma'am.
If you have any question, you are most welcome to ask.
Thank you,
Thank you
ma'am.
so much, ma'am.
Okay, we can stop here. Allah Hafiz.
Allah Hafiz, ma'am.